really just remarkable people. Just think about it. They're anxious and they put themselves in that situation because they're there to help other people. So God bless them. The focus for New York and every state in this country is about reducing the spread of the virus. We've said the way to reduce the spread, the rate of the spread, two-prong approach, reduce the density. Yesterday we announced measures to reduce the density, gatherings of 500 and over, et cetera. And the second way is to increase the testing capacity. The more you test, the more positives you find, the more you can isolate, the more you reduce the spread. You see, you learn from the countries that have come before, China, South Korea, Italy. The better you are at testing, the more you test, the more you can reduce the spread. I've told you that we've been talking to the federal government about the federal government authorizing states to do testing. State health departments regulate labs in their states. If you go for a test now at a lab that is regulated by the state, we need obviously more testing capacity and we need it quickly. So I said I spoke to the Vice President about this. Vice President Mike Pence is a former governor, so he understood the state's roles, Department of Health in regulating laboratories. He said he would look at it. I said I thought it could make a tremendous difference. I spoke with the Vice President today, and I spoke with the President, and they are authorizing New York State to do the testing and allowing our labs to do the test and allowing the state health department to set up the protocol. That will increase dramatically our testing capacity. I want to thank the President and the Vice President for their receptivity to the idea. And I want to thank them for their quick turnaround. We have the authorization as of today. So today, the State Health Department will be going out to the 28 laboratories that the Department of Health works with on complex testing matters, and those 28 labs will be authorized to do testing. So we're down in the boiler room now, turning all the valves. The labs will be coming on. We think next week we'll go up to a capacity of about 6,000 tests per day, which would be a dramatic increase for us. To date, we've done about 3,000 tests, so that is a very, very big difference. And testing is probably the single most important thing that we can be doing now. As I said, that will double. We'll be able to do about, in one day, all the tests that we have done to date, believe it or not. So again, I want to thank the Vice President and especially the President who facilitated this and moved quickly. A couple of quick items on the executive order. I'm going to do another executive order. There are issues that come up that need to be addressed. Unemployment insurance, we're going to waive the 7-day waiting period for anyone who was unemployed as a result of quarantine or laid off because of the virus. Local schools are making a decision whether to stay open or closed. That's a local decision. The state rule is if a child in that school tests positive, the school must close for 24 hours. So we clean the school, assess the situation, and then make a decision. Some of the schools want to know if they close, do they get penalized by the state for not following the 180-day rule, which is 180 days of class to qualify for state funding. We're going to waive the 180-day requirement. Some utility companies are in a position where people may not be able to pay their utility bill because they got laid off or they're working less. The PSC, Public Service Commission, is going to put out an order that says no utility can turn off a utility to a person who hasn't paid their bill as a result of responding to this virus situation. We also need to come up with an answer to political petitions that are now being circulated to put people, qualified people to run for election. Normally you go door to door with a petition and you speak to the person who opens the door and you ask them to sign a petition. This is not the best time to be sending people door to door. It's the exact opposite of what we're trying to do. I don't know the specific solution, but I know it's something that we have to address. We'll give you the numbers for today. That's the total number of people tested, about 3,200. The number of cases, current total 421. We've gone up 96. New York City, you can see, went up 59 cases to a total of 154. Westchester went up 10 to 158. These are the counties that have cases. Schenectady is actually a new county for a case. New York now has the highest number of cases in the country. New York and Washington go back and forth. Washington had more deaths, obviously, because it was in the vulnerable situation. Senior citizens, senior care facilities, nursing home facilities, those are the number one situation that we're concerned about through this. Current hospitalizations, 50 out of the 421 cases, that's a 12% hospitalization rate. 18 are in intensive care. We have 3,200 intensive care beds in this state. Total number of hospital beds of 53,000, but 3,200 ICU beds. When I spoke over the past few days, I've been talking about watching the hospitalization rate, and in particular, the rate of people needing the ICU. This is where Italy got into trouble. They didn't have enough ICU beds to handle the number of patients who needed intensive care. That is going to be a problem in this state and in this country. That's something that we have to watch very, very carefully. We've been talking to the hospitals about how do you increase capacity quickly, staffing capacity, facility capacity, canceling elective surgeries, which can add a significant amount of capacity. If you have an elective surgery, you want a hip replacement, some other type of elective surgery, there may come a point in time, and I would say it's probable, where we say we may postpone elective surgeries because we need that hospital staff to be taking care of this issue. But that is a major problem that we're looking at down the road. Again, perspective on all this, the Johns Hopkins numbers, everybody's anxious, everybody's nervous. Johns Hopkins has been tracking the facts. I understand emotion. I also understand facts, and you want to relax yourself. You want to understand what's going on. Look at the facts. Look at the facts. They have tracked every coronavirus case, 137,000, 5,000 people have passed away. You look into that 5,000 number, you're going to see senior citizens, you're going to see people who had underlying respiratory illnesses that were pre-existing. You're going to see people with compromised immune systems. The same type of people who would be affected by the flu, but at a higher rate of infection and at a higher rate of mortality. 69, almost 70,000 recoveries worldwide, 62,000 pending. We're dealing with the virus, and we're dealing with people's perception. Any emergency, any disaster, you have the issue that you're dealing with. It could be a fire, could be flood, could be an impending hurricane. You have the issue, and then you have the public perception of the issue. And the fear, the anxiety, the panic can be a more difficult issue than the underlying issue you're dealing with. And you have a lot of anxiety, I think much more anxiety than the facts would justify. But they are emotions, right? Emotions don't have to be fact-based. And part of my job is to say to the people of this state what the reality is and what they should expect. First, this is not going to be a quick situation. This is going to be weeks, months. I would calibrate ourselves. This is not going to be gone next week. It's not going to be returned to normal next week. Look at China, look at South Korea, look at Italy, look at the trajectory. This is months, so prepare yourself. And this is going to be everywhere. This day-to-day count, we're up 2, we're up 7. My guess is there are thousands and thousands of cases walking around the state of New York. My guess is there are thousands of cases of people who had coronavirus, didn't even know they had the coronavirus, had symptoms, resolved, moved on, and never knew they had it. 80% will self-resolve. There could be tens of thousands of people who had it. So this fascination with how many cases today, the number of cases we're doing to try to identify positive people, it is not in any way representative of the sample of how many people have coronavirus. So you have to keep that in perspective. Also, everybody wants to protect themselves. You want to protect your family. And you want to protect your children. What do I have to do? What do I have to do? People ask me 10 times a day. At one point, you can't control the situation. And that is where we are. You know, you can't protect yourself. You can't hermetically seal yourself and your family. Someone will touch your child. Someone will put their hand down and will put their hand on children. That's why the facts are important. Well, what happens to my mother? You're going to escape coming in contact with this is not going to happen. One of my daughters was in precautionary quarantine, right? She came in contact with someone who was in a hotspot, who we didn't know whether or not that person was positive, so she was precautionary quarantine for 14 days. It's my daughter, you know, that's everything to me. That's why I get up in the morning. How could I protect my daughter? Why didn't I protect my daughter? Because it's impossible. It's impossible. Now, my daughter is a young woman. She's not in one of the vulnerable categories. So I have to talk myself through the facts, right? You're talking about my child, right? You want to talk about emotion. It just goes up in you. So I had to talk myself through the reality of the situation and the facts of the situation to calm myself. So I understand fully the anxiety that people feel. I understand the questions. But again, the facts do not justify the fear. And I know more facts than anyone. I'm doing this every day. But my daughter was possibly exposed because you can't control it. Who knows where the cab driver was? Who knows where the person who sits next to you on the bus was? Who knows where your buddy was last night who may have come in contact with a person who then finds out that they were in contact with a person? You know, you can't. You can't. The good news is the facts. And yes, if you are in the vulnerable population, it's different. If it was my mother may have been exposed, then I would be more concerned. So what am I doing? I'm taking more precautions with my mother. And I talk to her about it every day because, you know, I'm just a son and she knows better than I know, and she gave birth to me, so by definition, there's nothing that I could ever tell her in my life that is valuable because she gave birth to me, so by definition, I am just inherently inferior, which I understand and happens to be true. But that's a different situation. So all of this to say, you can't, nobody is going to be immune from this. But the facts say we have to do what we have to do, but we're going to handle it and we're going to get past it. Questions?
Comments just now were kind of a rebuttal, if you will, to the calls for you to close schools statewide. What do you say to, and you probably have something very similar to say about specifically those calls to close schools?
Look, the call to close schools, there is a theory that children, while not affected by the virus, may be carriers of the virus. You close the schools, might you slow the spread? The closing of schools is a very difficult decision and a complicated decision, and there's pluses and minuses. I understand the pluses. I just mentioned the plus. The minuses are who says that the children aren't going to be in contact with other children? Just, you know, if you're not in school for a day, I know when I wasn't in school for a day, I came in contact with a lot more kids being out of school than in school. Second, how about the learning for the children? That is not going to happen now. Third, a lot of children are receiving breakfast and lunch at school. How do you do that? How do you get all those meals to all those kids when they're not in school? What distribution mechanism do you have? Then if the kids are home, what do the parents do? Well, the nanny can watch the kids. Yeah. Most people don't have staff at home to watch the kids. So if the kids are home, the parents are home. Well, if the parents are home, who's going to be working in my hospitals? Which is the critical system in all of this, staffing the healthcare system. So it is complicated. What we have done is we've left it up to the localities, by and large, and we have many schools closing. I don't know if that's always a judgment on the facts or if that is a response to anxiety in the local community, where parents just say, I don't want Johnny going to school today. By the way, attendance in schools is way down. Why? Because a lot of parents are saying, this is my child, this is my gift from God, this is my precious child. I don't know what's going on. I don't want them going to school today. I think you see that anxiety reflected in local school closings also. So it's not difficult emotionally. It's factually a very debatable premise. It's something we look at every day, something we talk about every day, because there are pluses also, but there are significant trade-offs.
How would that change? You know, you say you're tracking this, you're keeping track of this every day. What would change where you would say, you know what, we got like what Ohio's doing or Los Angeles today?
Well, look, you're watching the increasing curve of the spread, right? And if you look at what has been done in the past, if you're not slowing that curve, you take increasing measures just to bring down the spread. Now, we don't know if factually closing schools actually reduces the spread. There's a premise, a theory that says it does, but we don't know, in truth, Joe. You could close a school that could increase the spread, right? Nobody has factual data because we haven't done this before. But if the number keeps going up, you keep turning the knob to reduce, more testing, more density reduction, more testing, more density reduction, right? So we've now said on density reduction, the 500 gathering place, and then the 50% of occupancy. The number keeps going up, you turn that knob more. That's why you see you have some places on the globe where they just closed everything, right? Italy got to a point where they said grocery stores, pharmacies, everything else closed. That's as tight as you can turn that valve. But it's a calibration that you do day to day. We are saying to local school districts, for example, we're waiving the 180-day requirement, which means it's up to them without any sanction.
You're a Queens guy. You're not a shrinking violet. Bill de Blasio calls you on the phone and he says, Gov, what do you think? Should I close the schools?
Yeah, I get those calls all day long right
So
now.
what do you tell Bill de Blasio?
I say the same thing that I just said to you. I said, look, here's the pluses, here's the minuses.
So you say it's his call. It's up to the Blasio.
Well, it is up, well,
No, but let's be clear. Is it up to Bill de Blasio to close New York
they
City
are
schools?
local decisions, except when you have a child who tested positive. Now, the state says you must close it for 24 hours, period, and, new paragraph, you must consult with Department of Health. Because if you have a positive case in the school, then you have to know the facts and circumstances. And is there a possible cluster in that community? And that's something we have to discuss.
But state workforce, any changes?
Hold on 1 second. So you're saying if no one tested positive?
No, I guess the question is, to pardon the pun, like, it sounds to me like you're washing your hands of this question, right? It sounds to me like you're telling it, you're passing it off to localities and saying it's not my
No,
call.
I'm saying there is no, the state at this point, with these numbers, does not believe we need to close schools statewide. If a locality feels they should close schools, either because they think there's a health reason, or frankly, because they think there's an anxiety-based reason, I understand that. If the numbers tell us a different story, I have no problem setting a statewide standard. I mean, I set plenty of statewide standards, right? The 500, the occupancy ratio. But we don't have a position determined by facts and data that says the closing of schools would make a difference. And you know there are negative consequences. It is a very big deal if parents have to stay home. And it's a very big deal if we are short-staffed in hospitals.
That's looking into the DOH when it comes to testing. Is the state looking to contract with labs outside of New York?
We have 28 labs. We have 200 labs that are licensed in the state of New York. We have 28 labs which are, this is not the official term, but top-tier labs, in essence, that the Department of Health works with on an extensive basis. We're going to those 28 labs first and contracting with those 28 labs.
What about outside of the state, though? Is there any consideration for looking at
No.
labs outside?
Governor, this morning,
Excuse me 1 second, go ahead.
We did contract with BioReference, which is in northern New Jersey. That was the announcement the governor made yesterday. They're going to be doing 5,000 tests a day starting for us next Wednesday. And we are working with LabCorp and Quest. But as we discussed yesterday, because their facilities are so far away, that creates a 3 to 4 day lag on turnaround for results.
I stand corrected.
Testing,
Sorry,
there's
Sam?
5,000 tests that
Of the 28 labs, some are manual testing labs. They don't have the capacity to do the automated. Some are automated. Some labs have the capacity to do the automated tests, which we can now authorize.
Governor, you mentioned, first of all, sorry to hear about your daughter.
Thank
Good
you.
luck. This morning you mentioned 6 to 9 months possible life of this virus. Can you tell me where you got that information and elaborate at all on what?
My expert, what do you think, Don?
So we don't have an answer yet of how long this is going to be around. There have been discussions about whether it will change when the temperatures change, but just the understanding of how or pandemics like this run their course throughout the world. We expect it to be a handful of months, 3 months, 6 months, 9 months. It's hard to predict exactly how long. But one other thing is across the globe.
Governor, can you comment on whether or not there are any discussions to close down the state's court system?
I spoke with the Chief Judge yesterday. I've been talking to her regularly about this, Janet DeFiore. Again, it's a day-to-day situation. The court system is very important. But we understand the pressures also, but there's been no discussion about shutting it down. No.
Suspending the 30-30 rules.
The chief administrative judge ordering that, or imminently ordering that all criminal trials be suspended?
Frankly, I haven't gone through it yet. I was out of the office this morning.
What about suspending the sort of the evidence rules, the speedy trial essentially requirements?
We haven't had any discussion about that.
And then the state workforce?
State workforce is working. We haven't done anything particular with state workforce, have we?
No.
You going to do anything particular? You got?
It's something that we're talking about and evaluating on a day-to-day basis, but at this point, no.
Should voting be pushed back at all, March 24th, April 28th?
Look, this is a fluid situation. So we're dealing with all of these issues as they come up. The petition process, I understand, is problematic. We have to figure that one out. The elections we haven't discussed.
Governor, the federal government has provided a federalist approach where the states could decide on their own specifics of how to handle that. Was that the right approach? You seem to have been critical a little bit here and there about their approach, but is the federalist approach a good way of going?
I think the president did the right thing today. I think the vice president made the right call. That's why I said I thank him for his receptivity. Centralization of a function is very effective if the goal is quality control over flexibility and speed and volume, right? If you keep it centralized, CDC, FDA would say, I want to control the testing. Why? Because if I control it, I can make sure it's done exactly the way I want it done. Okay, I get it. That's the benefit of centralization. Many tasks we do on a centralized basis. Now you change the fact pattern. By the way, we need tens of thousands of tests all across the country, and we need them tomorrow. Centralization doesn't work. You must go to a decentralized model of management. And in this case, you have the states sitting there, and the states do this, right? This is not asking the state to do something that we don't do. You're not asking us to regulate the nuclear energy industry, right? You're asking us to do what we do. We regulate the labs. That's what we do. You go for a blood test, or that lab is regulated. So to me, it was easy because you're decentralizing, but you're decentralizing to a structure that performs that task already. Also, you know you have a problem on the volume of testing, and the centralized mechanism cannot do that for you. You can't come up to scale with a centralized management system. So I think it was the right call.
So why are you critical of the president for leaving it to the states to do their own testing and having to take that ball and carry the ball?
No, I think I asked for New York's ability to do the testing. I'm praising that decision. I'm not criticizing that at all.
Paid sick leave.
I'm doing the exact opposite.
But I thought-
I asked them to do it.
Before they approved it, you were critical of them having.
Oh, I think the
centralized
testing
control.
was slow. On a national level, I think the testing was slow. You look at the numbers, but I think this is the right decision.
On hospitalizations, how long does someone, on average, for lack of a better word, how long does someone have to be hospitalized? And like, I mean, how long are we talking like a bed is going to be in use for?
I think that you have to look at the clinical picture on this, because some people coming in, as the governor has mentioned, usually have an underlying condition, vast majority, and depends on what condition they come in with. And so you could say, well, they'll be in the hospital for 3 days with that condition, or maybe 5 or longer. So there's no one answer to that question of a specific number of days.
Equipment an issue at all? Italy has had a shortage on like ventilators and things like that.
But we're looking into all the issues of additional equipment, and we have purchased additional equipment as well.
Talking about nursing homes, I just wanted to say, there appears to be one in Westchester today, a positive case. Are you aware of that one, and are you concerned about?
I have not heard, Joe.
getting-
I've not heard. Let's just go back to Nick's question for a second. An ICU bed is an equipment-intensive, pardon the pun, bed and facility. Ventilators, oxygen, et cetera. 3,200 ICU beds. We do not at this point have the capacity to create additional ICU beds. It is different than just a temporary medical facility, et cetera. It's the highest level of equipment and facility. What you can do is, how do we free up those existing ICU beds to the best we can to handle a possible surge of coronavirus cases. But if you look at any of the numbers, the Times did a story today on the projections, it's not even close. If you don't flatten that curve, the wave is a tsunami that totally swamps the existing hospital system.
Should the casinos be closed, or is that something you considered?
That's something we're talking about today, because they're very large. You know, we did the 500 capacity.
Abide by that at least right now.
Well, no, we need a rule for a super mass environment, right? We said 50% occupancy, but you have casinos that have an occupancy of 20,000 people. So that's something we're talking about today.
The other thing is that important to remember is with casinos, you're not seated. It's not a situation where you're seated on top of each other for a prolonged period of time. And as the governor said, the capacity is massive.
Just on that capacity question, you put out the executive order today. You were saying that yesterday that it wouldn't apply to office buildings, but then in the order, it says quote unquote, any place of business. Can you clarify what the difference is there?
It doesn't, I'm sorry.
No, just like we were talking about yesterday, you said it's not going to apply to an office building where people are.
Well, because we're saying in office buildings, people are chopped up into offices, right? There are very rare exceptions where you have in one room, 500 people seated. I can think of none, actually. So, but we did provide an exception in there for things like factory floors. They can go reach out to Dr. Zucker. Dr. Zucker has the authority to grant specific exemptions if you can determine based on capacity that people have the appropriate social distancing.
But I'm saying, because in the order today said quote unquote, any place of business, so I just want to make sure it was clear.
Place of business versus office, you're right. Also, look, this regulation, we put in there that the Department of Health can make a determination on any specific situation, because it's very hard in one rule to capture every physical manifestation of every complex that you have in the state.
Is there any problem with using for treatment, the anti-malarial drug, the chloroquine, and the HIV drug, Coletra? It seems to have worked with Dr. Kai, who was infected at Times Square, but is in Northern Jersey.
Dr. Zucker's working on that.
We're working on that, yes.
Could you explain a little more?
Well, there are some studies out there to suggest that that may be helpful, and we're looking at, it was used overseas, and we're trying to get some more data about that.
Last question.
Governor, can you go into unemployment insurance? Can you go in more detail about how unemployment insurance could possibly cover people in quarantine?
Unemployment insurance right now, if you get laid off, which is going to happen for a large number of people, businesses that close, businesses that lay people off because they don't have the volume, right? Right now, there's a 7-day waiting period before you qualify for unemployment insurance. We're going to waive that 7-day period, so you will qualify for unemployment insurance immediately.
Well, the U.S. Department of Labor released a statement yesterday saying states could change their state law to have unemployment insurance cover people even if they still have a job, to cover them while they're in quarantine. Is that something the state's looking at?
We're not doing that. We're just waiving the 7-day waiting period.
Based on the paid sick leave negotiations,
Say that again, I'm sorry?
kind of jumping off that, the paid sick leave that you proposed, and, how are negotiations going with the legislature? There's been talk that could pass early next week.
The paid sick leave bill?
Yeah.
We've been speaking about the paid sick leave bill. We added a modification to specifically cover the quarantine situation. But the paid sick leave made sense before. It makes more sense now. The federal government is even talking about a paid sick leave bill. So to me, that was a no-brainer before, and it's certainly, I don't know what's more obvious than a no-brainer.
How
Early
would that
voting
work with the
begins
quarantine, though? How do you
tomorrow
clear
for
the
the
quarantine?
Queensborough president race. Do you think that that should be postponed?
We haven't made any decisions about any elections. I understand the question and the issue, but we haven't made any decisions.
New York City says it doesn't have the authority to move to automated testing. Does this are they included in this 28? You said some labs might be able to.
Labs in New York City are definitely included in the 28, yes. Some of the big labs, Mount Sinai is a big lab for us. NYU, Langone is a big lab. Columbia Presbyterian is a big lab. I've spoken to them directly. We actually have new equipment going to those labs to allow them to do the automated testing at a higher volume.
What about public labs, like the city-owned facilities?
It depends on they can have the authorization. It depends if they have the equipment or not. We actually had to there's a manufacturer who has the most sophisticated, high-speed automated testing machines. And we're getting those machines for NYU Langone and Columbia Presbyterian to allow them to do this higher level automated testing. So the fact that we can authorize it is good, but you still need the equipment and the machinery to do it.
When it comes to this virus is going to be as widespread as you say it is, at what point does testing become less important? Or is it merely diagnostic, or are you still trying to track people? Or what's the tipping point there for you?
It's a good point. It's a question of math. It's a question of science. I would defer to the determination by Dr. Zucker and the national experts at that time. Germany basically has said, you can hit a point where the testing is finding so many positives that you don't have the capacity to go back and track them and shift your resources to something else, hospital capacity, for example, or focusing on just the vulnerable populations because those are the ones with the highest mortality risk. So just focus on senior citizen homes exclusively. That's a determination you make as the situation changes, right? Where we are now, we're still in the phase, let us track down as many positives. Let's reduce the spread by isolating the positives. Do
you think that's working, though, at this point, considering the spikes?
Oh, it is working. See, the spikes, again, Jesse, this is in no way representative of how many people have coronavirus. These numbers are spiking because our testing capacity goes up. When our testing capacity goes up next week, you'll see 1,000 cases of positive. Why? Because we're going down the positive track. Well, look at the spike. No, the spike is the spike in our increased testing capacity, not in the percentage of people who have coronavirus.
You don't feel it's spreading as rapidly as it has in other places?
I'm not saying that at all. I'm saying these numbers can't tell you that one way or the other. These numbers don't answer that question one way or the other. And they're not even evidentiary. You have 400 positives of people who were probably positive, right? That's how you got those people to test. You were going down the chain. These are not random sample tests. I believe, and I think if you talk to most healthcare professionals, they will say it is much more widespread today than you know. It was here before you knew it. It was wider spread in the past than you know, and it will spread more than you think, right? You're talking, some other countries are talking about a 60%, 70% infection rate.
I'm sorry, can I ask you, you visited New Rochelle?
Wait, excuse me one second. Do you want to comment on any of that?
I think the governor covered it exactly correctly.
No, I was going to say, on that point, you visited New Rochelle today, you've taken a variety of steps there, including the 1 mile radius, the quarantine from last week. How effective and how important was it to take those steps in a place where you knew you had this hotspot?
Well, look, what we did in New Rochelle, again, I follow the data and I listen to the science. But it was also common sense what we did in New Rochelle. New Rochelle was, you have the highest cluster in the United States of America. You map it, there it is staring at you. What do? Close the schools, no gatherings. That's all the containment area meant, by the way. That word containment area really was misleading. Nobody was contained, right? You could come and go. Nobody was contained in New Rochelle. We were trying to contain the virus, right? Not people. And the National Guard was not a big government response. They were there to help clean and deliver food, et cetera. But anyway, yeah, it was common sense and what the science dictated. The testing in New Rochelle is exactly right. So you do everything you can, right? Just do everything you can. How effective is it? You don't know. You don't know what it would have been if you didn't do it either. So just do everything you can.
Governor, what day next week do you expect the testing capacity to reach 6,000? Is there a specific day or time in the week in the beginning, or?
If I had to guess, which makes the doctor really upset when I do it, I would say midweek.
You talked about,
The post that New York is slated to get $750 million a month in coronavirus economic stimulus money. Have you heard that from the federal government? Do you know what he's talking about?
Who said that?
Chuck Schumer.
The bill that passed, the first bill that passed?
I think this is something completely separate.
Look, the bill that passed gave New York State $17 million. No, it was total $17 million. That's what it gave the state of New York. It then had another pot that is a discretionary distribution by federal agencies. Whenever there has been a discretionary distribution by a federal agency, you know what we've gotten? Zero, nada, niente. We are not on their top 10 hit parade list as a state, right? So the only thing that bill said New York must get is $17 million. And what I'm saying to my federal representatives, and I know they don't like to hear it, but by the way, we all have a job, and my job is I represent the people of the state of New York. That is my job, nice and simple. And I'm saying New York deserved more, New York needed more. We have gotten the short end of the stick by this federal government repeatedly and routinely since this administration started. And I understand the frustration of the legislators who say, well, we're in the minority, there's nothing we can do. Yeah, but when there is something you can do it. That's my point. I have to go to work. Thank you, guys.
Set aside in the budget?
I have to go to work.
Is she in quarantine?
Precautionary quarantine.
Is she in
did you meet with her? Did you?
No, but I miss her.
Is she still in precautionary quarantine?
No, no testing.
When did that end?
What about closing the Capitol?